Hello everyone, welcome to KNO Academy. This is Praveen and welcome to the high yield topics discussion session. So today's topic of discussion is the Bleuler 4A's. So as already you people know, we are discussing some important high yield topics for various competitive examinations. So one of the topic in psychiatric nursing, that is Bleuler 4A's. So this is the important topic. We'll discuss some important points. This particular Bleuler 4 is, everyone knows, it is related to schizophrenia. So schizophrenia, as you people know, it's a like one of the psychotic condition. So when we say the term psychotic, the patient has to exhibit either delusion and hallucination. So these are the typical features of psychotic condition. So delusion means a false firm belief. As everyone knows, it's a false firm belief. When it comes to hallucination, which is a perceptual abnormality. In simple words, we have to discuss here. A perceptual abnormality where misinterpretation of the external stimuli. Misinterpretation. So this is the typical meaning of hallucination and delusion. So overall, schizophrenia. Yes. So related to the term schizophrenia, we have to understand certain historical event. So the first historical event when it comes to the term schizophrenia. So we are discussing regarding Bleuler 4A's. So the related topics we have to discuss. Here the main related thing when it comes to the term, like the first person is Benedict Morel. Here the first person is Benedict Morel. Like he coined the term. So he coined the term demens precoce. So according to Benedict Morel, like he given or he coined the word demens precoce, the first historical event, like when it comes to the term of schizophrenia. Yes. Next person is, that is Emil Kraepelin. The person is Emil Kraepelin. And he given the term dementia precox. So according to Benedict Morel, he given the term or coined the term demens precoce. According to Emil Kraepelin, he coined the word dementia precox. So both are very important when it comes to the historical event. And the next historical event, the topic of choice, today's topic of choice, that is Bleuler 4A's. So this Bleuler 4A's, which is given by Eugene Bleuler. Eugene Bleuler, first question. Here we can expect Bleuler 4A's given by Eugene Bleuler. And the second thing is, like he given the Bleuler 4A's for this one, for schizophrenia. The disease condition is schizophrenia. Actually, he coined the word schizophrenia. Bleuler, that is Eugene Bleuler, coined the word schizophrenia. Next, the meaning of schizophrenia. We can split the term into schizophrenia into two. One is schizo And the one more term is phrenia. Here schizo means split and phrenia means mind. The person who is having split minded are like various features. In simple words, he like coined the word schizophrenia, which is we can split into schizo, that is split, and phrenia means mind, split minded individuals. Yes. Next, so the next is regarding Bleuler 4A's. So the one more question, Bleuler 4A's given by Eugene Bleuler. Eugene Bleuler, and the first A. So there are 4A's. Number 1, number 2, number 3, number 4. The first A is like associate disturbance or association disturbance. Association disturbance. And the second A, that is affect disturbance. Affect disturbance. And the third term is autism or artistic thinking. And the last A related to ambivalence. So these are all the 4A's which is given by Bleuler. Association disturbance, affect disturbance, autism or autistic thinking, at last ambivalence. We'll take each one and we'll discuss regarding the typical meaning of the particular terms. So the first term is, that first A is related to association disturbance. Association disturbance. The typical meaning of association disturbance means here there is there is no continuity in the thought. There will be disruption of thought we can expect. One thing when it comes to association disturbance, like disruption of thought. So due to the disruption of thought, the person or the patient is going to change from one topic to other topic. So that is the typical concept what is going to happen when it comes to association disturbance here. And one more thing here we can able to expect is loosening of association, means there is no logical connection between these sentences. Loosening of association. So this is the content. When it comes to the example, so you just take a situation where we are discussing about favorite food. I will write here, we are discussing about favorite food with one person. So he was talking about the favorite food of him or her, but suddenly he changed the topic to train accident. Train accident. So here there is no logical connection. So favorite food and train accident, there is no logical connection. So this is the association disturbance, first A. And the second A is, that is like affect disturbance. The affect means it's a short span of emotional expression. Short span of emotional expression. So this we can call it as affect. The emotionality, how we are going to exhibit our emotions, like either happy or sad or even cry. So this we can able to expect. When it comes to the disturbance, affect disturbance, here either it is flat flat affect or blunt affect, or like one more thing, inappropriate affect. Inappropriate affect. So these three. So when it comes to the example, so you just uh, we are telling some sad news to the person, but he is going to laugh. For example, sad news, but the patient is going to laugh. Or then one more, we can able to tell, like any happy news, like no no happy emotion, no, or no happiness we can take. Yes. So this is the examples for affect disturbance. So we discussed 2 A's. Then third A is autism. Third A is autism or autistic thinking. So that we can tell, we can able to tell. But here, when it comes to autism, like the patient is in the fantasy thinking, fantasy world, is not in the reality. Fantasy thinking one thing. And here, that this much is enough. Like autism means fantasy thinking is not in the reality. Like unresponsiveness, example is unresponsive to the questions which is asked by others or examiner. So this is the meaning of autism, that is third year. Like the fourth one, that is last one, ambivalence. Ambivalence, where here the person is having the confusion, like due to the confusion is inability to take decisions. So inability to decide means here there are, the patient is stuck between two contradictory wishes. So this we can able to expect when it comes to ambivalence. When it comes to the example, a child is having both love and hated behaviors towards father. The child is like the father, and also at the same time is going to hate the father. Both these things, like both symptoms the child is going to exhibit. So this is the typical meaning of the ambivalence. Means there is a confusion, the person is not able to decide which one has to select. So this about the entire concept of autism. So sorry, it's not about autism, it's about the Bleuler 4S. So when it comes to the important questions, so here this one also an important thing, Benedict's moral. So in some question paper, this question is also there. Then dementia precox, who coined the term dementia precox, so that question also there. Then who coined the word schizophrenia, this also one question, most frequently asked question it is. Then, and obviously this is a very important the things, Bleuler 4S, except questions we can expect from this slide. So overall, and this is a like typical meanings that you people should understand for your the like examination. So this about the today's high yielding topic. So thank you, and wishing you all the very best for your examination preparation. Thank you.